White House unveils major deal to cut weight loss drug costs and expand Medicare access. President Donald Trump has announced a landmark deal with major pharmaceutical companies, Eli Lilly, maker of Zepbound and Mounjaro, and Novo Nordisk, maker of Wegovy and Ozempic, to significantly reduce the price of popular GLP-1 weight loss drugs and expand their coverage under Medicare. The announcement represents one of the administration's most substantial interventions in the pharmaceutical market, directly targeting the high cost of highly demanded anti-obesity medications, lower prices and direct-to-consumer sales. The deal focuses on making the initial stages of treatment more affordable and establishing a new direct purchasing channel. New low prices under the agreement, the starting doses of certain GLP-1 treatments, including both existing injectable and expected future pill versions, will see a drastic price cut. $149 per month. Future FDA-approved oral pill versions of these weight loss treatments, GLP-1s, will cost as little as $149 per month for the starting dose. Injectable discounts. Injectable versions will also see reduced prices for self-pay patients through a new federal platform. The average price for these injectables on the new TrumpRx direct-to-consumer website is projected to start around $350 and drop to approximately $245 per month over the next 2 years. Expanded Medicare eligibility. A crucial part of the deal is the expansion of coverage for these drugs under the federally funded Medicare program, which primarily serves Americans aged 65 and older. Expanded coverage. Currently, Medicare typically covers these drugs only for patients with type 2 diabetes or specific cardiovascular conditions. Starting next year, 2026, Medicare coverage for the GLP-1 drugs, Wegovy and Zepbound, will expand to patients with severe obesity and related high-risk comorbidities such as prediabetes or cardiovascular disease. Patient cost cap. Eligible Medicare beneficiaries who meet the expanded medical criteria will have their monthly copay capped at $50 per month for the medication. The government's subsidized price to the pharmaceutical companies for Medicare patients will be approximately $245 per treatment. Implementation and context. The changes are tied to an initiative driven by an executive order to bring U.S. drug prices more in line with other wealthy nations. Phased rollout. The reduced pricing and expanded Medicare access are expected to be phased in, with the first changes tied to the launch of the TrumpRx direct-to-consumer platform, which is anticipated in early 2026. Budget impact. Administration officials have suggested that the increased cost of covering these medications for millions of new Medicare beneficiaries could be offset by long-term savings resulting from improved health outcomes and reduced treatment costs for obesity-related conditions. The agreement is being hailed by the White House as a major win for lowering healthcare costs and addressing the national health crisis posed by obesity.